I would like to invite Dr. Mohammad Shahid. He's an assistant professor working in Faisalabad Medical University, and his topic of presentation is pattern of dermatological disorders in pediatric patients.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. रब्बी ज़िदनी इल्मा। इस दुआ के साथ ऐ अल्लाह हमारे इल्म में अज़ाफ़ा फरमा और हम सबको मक्का पाक और मदीना पाक की हाज़िरी नसीब फरमा। Respected chairman, co-chairman, next please. Next please. Respected chairman, co-chairman, dear audience, I am going to share the original study of pattern of dermatological disorders in pediatric patients of Faisalabad. Pediatric dermatology, a need of the hour. There is increase in the number of dermatological disorders in pediatric patients, provoking an important public health problem in pediatric dermatology. The pattern of skin diseases varies from country to country and even in the same country in different regions. In one study, 30% dermatological disorders examined by the dermatologist and 30% by the pediatrician, 40% by the general practitioners, more than these two figures, more than the pediatric dermatologist. This current study will help to understand the magnitude of growing incidence of pediatric skin diseases, and it will also help to take preventive measures to improve the skin problems in children. The objective of this study is to determine the pattern of various skin disorders in pediatric patients of Faisalabad. This study was conducted at Pediatric Dermatology Outpatient Department of Children's Hospital and the Institute of Child Health, Faisalabad. Patients and methods. This is an observational study comprising on all the patients who attended the Pediatric Dermatology Outpatient Department from 18th July 2017 to 17 July 2018. A detailed history and cutaneous examination were carried out on every patient. Skin biopsies and other investigations were performed where indicated for the confirmation of diagnosis. This is the data collection chart of 1 year duration. This data was analyzed and results were drawn. The total number of patients were 24,342, and the gender distribution were 11,245, which is 46% females, and 13,097, about 54% males. And the age range was 0 to 14 years. and the mean age is 6.2 years. 16,322 patients were examined between the age of 2 months to 6 years, which is 67.05%. 8,020 patients were examined between the age of more than 6 years to 14 years, which is about 32.95%. The total number of dermatoses observed in this study were the total patients 24,042 and 183 types of dermatoses were observed, and 142 types of dermatosis were observed in females, and 149 types of dermatosis were observed in males. And the most observed dermatoses were papular urticaria, scabies, folliculitis, impetigo contagiosa, atopic dermatitis, napkin dermatitis, carbuncle, furunclosis, urticaria, chickenpox, contact dermatitis, burns, hypertrophic scars, seborrheic dermatitis in the descending orders. And in the miscellaneous dermatosis, there is psoriasis vulgaris, acute urticaria, neonatal LD, juvenile dermatomyositis, infantile hemangioma, Samban patch, alopecia areata, vitiligo, infantile scar, and the rare dermatosis. These are the rare observed dermatoses: Cockayne syndrome, Kindred syndrome, lamellar ichthyosis, Perry-Romberg syndrome, xeroderma pigmentosum, NHAM, anhydrotic ectodermal dysplasia, multiple myeloma, cutaneous aplasia cutis, lipoid proteinosis, incontinentia pigmenti. And these are the other rare observed dermatoses. These are the clinical pics of the patients. You can see a number of patients. This is typical scabies, papular urticaria, impetigo. You can see the steroid-induced atrophy, steroid-induced stria, perianal genital warts, ophiasis, marginal alopecia areata, ectodermal dysplasia. This is not working. The other pics of the patients: zinc deficiency, Cushing-White facies, Cushing syndrome. You can see the miliaria crystallina, herpes zoster, tinea capitis, Samban patch, and misused steroid-induced, you can see the modified tinea, hydrotic ectodermal dysplasia, epidermolysis bullosa, we call it butterfly baby. And you can see the lichen planus. Everything is here, everything. You can see the lipoatrophy, alopecia areata. Respected chairman and co-chairman, if you allow me, can I ask one question from the audience? Anyone tell me the logo of this conference? What is the name of the logo of this conference? Anyone tell me? This is the theme, beta, this is the theme. What is the logo? Butterfly. This is the logo is butterfly, epidermolysis bullosa. We call him nowadays butterfly baby. Handle these babies like a butterfly. And I can ask, if you allow me, can I ask one more question? Anyone tell me how many butterfly logos in this hall? How many? 1, 2, 3, 4. Anyone? 4. 3. Yes, 3. 1, 2, and in front of me, 3. Okay, 4. 4 or 3, you can see the more than all of you. The logo is R. The number of logos are more in this conference. And this is all above the conference, which is 37 PADCON. And the theme is incorporating advancement in dermatology. Why not pediatric dermatology? Incorporating into the dermatology. Someone is saying here the audience on the other hall are more. The session is very interesting. The aesthetic dermatology. The butterfly baby. Please feel the pain of these patients. Feel the pain. How to handle these babies? I have guidelines. I have sent it to PAD forum. A number of guidelines. They need our help. We have to support them. We have to give more time of our busy practice in respect of reassurance, in respect of counseling, in respect of providing handouts of guidelines. The next is ectodermal dysplasia, and Julie is nowadays renowned model of the world. After adopting these procedures, these methods like reassurance, like counseling, and having the guidelines how I can spend my future life. These are the guidelines. I have sent it to PAD forum. Please print out from that forum. The data suggests to understand the magnitude of growing incidence of pediatric skin diseases. Skin infestations were most common pediatric skin disorders, followed by bacterial diseases. Skin infestations like scapular urticaria 26.21%,